Hey, Dr. Calvin, KNRX. This video, we're going to go over the compression to distension technique for the low back using the KNRX. One of my favorite areas to work on with the cane. The first one I'll show you, which is probably the most commonly used, is just using the balls here to work the low back on the floor. Pretty easy. I'm going to step over to my table here, and you're essentially going to be on your back, okay? First, the area we're working in is basically right where the rib cage ends, not on the center, not in the middle, but on these groups of muscles right off to the side. That's essentially where we want to be. Those are the lumps of muscles that are right over the top of those joints that have a tendency to get real tight in your low back. And so as we want to get right over those so we can work those in that reprogramming, in that loosening up, in that distension process, all those structures will start to loosen up for us. And so we're going to start in that area, and then we're just going to step it down. Now, in the low back, it doesn't matter. You could start up. I usually start up, but you can start down low as well, and then work your way up. Again, the rule is you're going to leverage compression to that threshold, wait for that to fade, and then you're moving it. There's a progression to this. We're going to start off on our back. I'm going to take the cane. Now, I like to use the cane. If you have a table like this, it's nice. But the reason I like to keep it on the cane is because I like to use this part as a little bit of handle. So I will rotate that 90 degrees. So say I'm on the floor, part's going to be sticking up, this part's going to be flat, and I'm just going to stick that underneath there. And then I can position those balls in an area that I want them to be in. Sometimes when you buy that peanut where they're already connected, that's fixed. And some of us have a little broader back, or we just want to work a little broader area than, like, say, right next to the spine. We want to broaden that out a little bit. And that's what these balls on here are for, is be able to do that. So we're going to position that where we want that. And then I'm taking my hip height, and I'm going to slowly just start lowering my hips until I get to that threshold. Now, I may not be able to get my hips all the way down. Too often people just that is their goal, is to get their hips all the way down, and their back is screaming on fire, and they're making themselves miserable, and they're not getting that distension they want. So you got to be careful, at least, especially in the beginning, where we're just going to allow that threshold, remember that pressure threshold, as much as you can take and stay totally relaxed, to dictate our height here. And then when we get that, we're just going to hold. Now, bringing your feet a little bit closer to your bum, that's going to give you a little bit, it's going to make it easier for you to hold in those positions. You may even have to put a pillow underneath here in the beginning to help you relax, but I don't want you going beyond that threshold. And then we're going to hang there. That fades, and then we're just simply going to grab the cane. I've got this handle here, I got this handle here, and we're going to pull the cane down a notch, and then we're going to repeat that. Threshold, that fades, and we're going to move it down. Again, about a ½ inch is the increment that I want you to use. We're going to be very thorough in creating that distension. Those discrepancies live throughout that tissue, and our goal is to create this global uniformity in that tissue. So again, compress, threshold, let that fade, and we're going to walk that all the way down. And we're going to walk that all the way down into these areas here, into what's called your SI joints. Now, as you get in here, it's going to feel more bony. That's okay. Use that threshold to dictate that. It's going to feel more bony, but it's still got layers of tissue and structure in there that you want to distend. As you've moved through here, it's a fantastic idea to work out into these areas as well, to get at least the top of that buttock region or that glute region, because that plays such an intricate role on what's happening here. Now, there's a progression if we're using the balls. So as we get back in that position, and we lower down and say you're getting resiliency back in that back, which will happen. You won't start off getting those hips down, but after you do this for the next couple of days, weeks, you're going to start getting those hips all the way down. Now, say that's still not at threshold. Now we're going to go ahead and bring those knees up like we're doing a deep squat. And what that's doing is pulling that fascia and that low back tighter over the top of those balls. And so now you're getting a deeper compression. And say that's still not at threshold. Because again, when your back gets healthy, you're going to be able to do this. And now we're going to crunch up. And that's even going to pull that tissue, that fascial complex, even tighter. So that's going to be the buildup. And when you get there, we're going to call that baseline. Okay? So you don't have to have somebody come and step on your stomach to drive it down any further. We'll just call that baseline when you can do the squat position and the crunch over the top of the balls. So that's the ball setup. That's probably what most people are most familiar with. And as far as like trying to do some compression in the back, it's easy, it's passive, it's on the floor. I love it. But what the cane enables me to do is get a little bit more just advanced type of compression techniques with some range of motion stuff, which I love to do. And this is going to be, maybe you don't do it right off the bat. Maybe you do it when you're a little bit more comfortable after using the ball. But now I'm going to stick this thing out to the last set of holes before the scissor holes. So second to last set of holes. And I'm going to grip, either and put that in my door anchor, or I've got again on the squat rack. And now, as you can see, I'm going to be able to take this and put this right where in that part of the spine. Now, again, I can only do one side at a time here, but that's okay, because what's going to happen is I'm going to get that to that threshold, and I'm going to get that to fade. And now I'm going to be able to put a little bit of range of motion in it, which is, this is, if anyone has ever done this, this is the bee's knees. This is fantastic. So I'm going to be able to lift that knee up a little bit, get some range of motion as I'm compressing that tissue and sort of forcing it underneath there in sort of that ironing fashion. Kind of, just kind of like you're just like running an iron through there, and I could just step that down. This is great if your back pain is just like one-sided, and so you could really feel like you can get in there and isolate that, especially if it's really sore and you're not really comfortable getting on the floor, because it just hurts with all that movement. You can just take this sucker, put that back in there, and now you're up and running, and you're doing quite a bit of be able to get in there and distend that really, really well, and go down into all those nooks and crannies, which are just actually kind of hard to hit while you're on the floor. You can get out into here, and you can even venture out into that hip, which not uncommon. If you've ever had back pain, you know, especially if you've had an SI joint problem, that likes to involve that hip complex as well. And so that's going to allow you to do that. If you're in that position, because it's all the way extended out, there's going to be a little bit of wiggle in here. That's fine, and that's by design. And so you can feel like you get a little bit of springiness, but that doesn't make you comfortable. Just bring it back to that middle notch. And now that's going to give it quite a bit more stability, and you could go all the way in if you'd like. It's fine. Whatever you're comfortable doing, this will allow you to do all the different range of motion stuff as well. My preference is to have that out there to that last notch. I just like that kind of leverage, and I like that springiness in there. So that's the compression distension technique for the low back. Want to try to do that at least once a day, maybe even working up to 4 times a day. Give your body, like the skin, a little bit to acclimate, because as you're putting that pressure back in there, the skin's going to get a little bit irritated. And that first, say, 5 to 7 days, where it'll just sort of give you a bruised feeling. Still okay to work back there, but if you actually get some visual bruising, take a break, give it a couple of days off till that goes away, and then you could start to re-engage in that area again and start doing that again. Eventually that skin sort of calluses, and you're not going to get that irritation to the skin. And then you're just going to feel just that deep, rich sort of therapy through that compression, just getting that muscle sort of unwound in there. It's going to feel great. Okay, that's going to cover the compression to distension technique for the low back. Bit extensive, but that's a major one that people, too many people suffer from, and hopefully that's going to help you out. And watch the other videos following. We're going to have the stretches that I like to do, my number ones for the low back and the low back exercises as well. So again, hope that helps. Thanks for watching. Have a great day.